Orthopedics sort of seemed like a very natural fit for me. I enjoy the technical aspects of the surgery, and I think the benefits for our patients are really quite phenomenal. It's very rewarding to see that. This should be somewhat end-bearing because that is your kneecap that's been tucked up into the femur. It works kind of nice. Huh?
Everything has just been so smooth that really I haven't had any extra expectations. It's just to make sure everything was just healing properly so I can get back to walking. I've been working with prosthetic and stuff like that in the last month, and I'm beginning to walk again. It's healed up amazingly, so you did a really good job.
How's your baby?
Awesome, she's getting big. She's like doubled in size.
We get to know the patients quite well, see them for years before surgical intervention, do surgery, see them improve dramatically in terms of their quality of life, and then get to follow them again for years after that. So it's a very nice relationship with the patients and seeing them improve. How you doing, bud?
Doing good, Dr. Watson.
Fantastic. How's that leg feeling?
It's feeling great, actually. No pain whatsoever. Experience with Dr. Watson was great. He was actually very nice. He was the one that did surgery on me. The only doctor I've seen ever since I broke my leg was him, and I trust him overall.
Go ahead, Steph. Let me see how you're walking. Are you walking normal now? Let's see. Now you're doing good. All right. It's not just cookie cutter medicine and surgery. It really does require a personal approach. The ultimate goal is to work with that patient to restore the highest level of function possible.
Yeah, the work you did was amazing. Super impressed. You're going to get my mother as a new patient because she needs knee replacement.
Oh, wonderful.
Good.
I've had nothing but great experiences. Very attentive, very comforting. My hope is to get healed as quickly as possible, but doing it the right way.
We try and go through a progression of treatments, each expected to alleviate some degree of the discomfort and return some function. I think I love almost every aspect of my job. I think the most rewarding thing is to see the patients on the back end of treatment when they're doing well and return to activities pain-free.